Today's presentation is on using publicly available data to tell your story. The objective of today's presentation is for participants to understand what secondary data is, why you would want to use secondary data, how to assess the quality and fit of secondary data sources, how to navigate several secondary data websites, and when and how to use or not use secondary data. First, when would we use data? Data can be used to better understand programs, for program improvement, to make programmatic or organizational decisions, to gain staff buy-in, for recruitment, to secure funding through grant proposals, for getting good ideas heard, to gain visibility, and to identify gaps, whether that be organizationally or programmatically. You might wonder, how do we go about using data? What steps do we need to take? First, you need to know what data is available. And then from that available data, what stories are you able to tell with the data? For example, could you talk about the needs of your community? Could you talk about health disparities? Then you need to identify who needs to hear the story. This could be potential funders, could be policymakers, or it could be your board of directors. And then you need to identify the type of presentation of the data that works best for your audience and purpose. Sometimes a report is best. Other times it could be a PowerPoint or an infographic, or sometimes even a tweet would be the best. So today we're going to delve in and really understand what secondary data is. Secondary data is data that is collected by someone other than yourself. Common sources of existing secondary data include data collected by government organizations such as the Centers for Disease Control or census data. Secondary data can be used for various purposes. So why is secondary data important? First, secondary data allows for access to large amounts of information in data sets. One example is the Centers for Disease Control. This site provides a large amount of secondary data that covers a variety of public health topics. Secondary data is important to understanding what your topic is and what it looks like within your community, county, or state. What risk factors are prevalent? What protective factors are prevalent? You want to understand the whole picture of what is going on within your community or state. Secondary data is extremely efficient and cost-effective. Since the data has already been collected and analyzed, you are saving lots of time and lots of money, and it is easily available to access. Secondary data helps you understand the scope of an issue on a local, county, or state level. You really want to understand how your issue is impacting your community. Secondary data can be important for securing funding. This data can be used to write a grant, to focus on a new program that may be focused on decreasing risk indicators in your county. Secondary data can also be used to make decisions, such as strategic planning decisions on where your organization wants to put their focus over the course of the coming year. Secondary data can also be used to decide what indicators may be important in regards to developing a new program. So how do you decide what data to use? The most important thing when you're looking at data is thinking critically about it. First, you want to know what is the source of the data, and is that source reliable? This is important to understand as a source such as the Center for Disease Control has much more credibility than Billy Joe's personal website. The relevance of the data to your organization is also important. How relevant is the data to your project? Having recent data is very important. You do not want to have data that is older than 10 years. If data is available every year, that is wonderful. That is not always the case, but you want to have the most recent data that is available around the topic you are interested in. What is your scope? Do you need local data? Do you need state data or national data, or a combination of all of these? And who is your audience? Are you going to use the data to obtain more funding? Are they a local funder? Are they a state funder or a national funder? You need to know what speaks to them, what compels them. So in a lot of cases, you will have various data sources with the same types of data around your topic area. So it's important to analyze which of the data is going to be the best for the purposes that you need it for. So the process for this is very similar to evaluating the data, but instead of evaluating one source, you're going to look at all the sources that are available and evaluate which source's data is best overall to utilize for your purpose. So once again, what is the source of the data? Which data source is the most reliable? What data source is most relevant to your organization and/or project? What is the most recent data available? In most cases, you will want to use the most recent data available, but there may be times that you will want to use the most consistently updated source of data. So different sources of data, it's important to know, can be updated on different schedules. Some may be annually, others may be every 10 years. So if you have an available source that's updated annually, you would want to use that source. And once again, who's your audience and what information is most easily understood for your audience? And then it's also important to look at how easy to locate and obtain data is. Some data sites are going to be much easier to navigate than others. And this can also depend on your level of comfort navigating various data sites and your knowledge of the data. Some sites present data that's already available formatted, while others require more work to go into it. So where would you want to use secondary data? Secondary data can be used in presentations, grants, brochures or infographics, other handouts. It can be used to educate others, such as policymakers, and it can be used on social media or a different website. How do you use secondary data? Data can be used to educate others, including in presentations, brochures, or in other ways for individuals that may not be versed on the issue. Data can potentially be used to make general comparisons between counties or states, but it's important to know that this is only the case if the exact same data is available from the same source for the areas you are looking to compare, and that you are sure to take into account that counties and state vary differently in their composition and their resources. You need to ensure that you're careful in how you present and/or word any comparison data. You must also ensure that any data you provide is valid and can be backed up. You can't assume that data provided on the web is always right. You really need to do your research that your source is valid and that all data is available to back up what you are presenting. Other ways to use secondary data is to use data to show changes in indicators over time. Be careful with this. You want to make sure that you do not make statements on what is causing changes. So while data is sometimes provided for variables over time for a particular geographic area, you really do need to be careful in making any assumptions or statements on what the data is saying. There could be many reasons data changes over time, and you're not able to make inferences as to why this difference may be occurring, as the secondary data that's provided is a snapshot, and it does not imply causation for any changes. Data can help inform decisions on focus populations, risk and protective factors, and programs. It can show populations that are particularly impacted by various issues, and also show risk and protective factors that need to be focused on. Data can inform program decision making by seeing what story the data is telling and using this information to develop more effective and efficient programs. And always cite your source. This is not your data. It is from another source, and you need to be sure to give credit where credit is due. Also, citing a relevant and valid source, such as the Centers for Disease Control, can also give more leverage and credibility to the data you are presenting. How to not use secondary data. Do not use data to state what is working and what is not. It may give clues to what may or may not be working, but it doesn't provide a full answer to this. As such, you are not able to state that something is working or not working, as you do not know what is impacting the data. Once again, the data is a snapshot and should be used in this context. Think of it as rather this is what needs to be worked on. Do not state that a change in the data is due to a program your organization is implementing, as secondary data sources will not back this up. Do not use small numbers. It's important to recognize that you have to have enough individuals in a study or enough data available that it can be generalized to a certain area. Small numbers do not allow for this. And do not overstate data. Data should only be presented as what it is, not as what it implies. Now we will start exploring several different secondary data sources. The first website that we will explore is the Michigan League for Public Policy Kids Count in Michigan. This site has various data sources, which include the U.S. Census Bureau and the Michigan Department for Health and Human Services. The data sources for each indicator are easily available in the Michigan Data Book. By scrolling to the bottom of the data book, you will see that it has background indicators, and it groups together each of the different indicators, and below that you will see the source, including the year for each of the indicators. For the current presentation, some example indicators that you may be interested in could include child abuse, infant mortality, economic indicators including poverty, educational indicators including information on students not graduating on time, lead poisoning, and students in special education. Indicators that have a low incidence or are unavailable data are not calculated and available on this website. If we are to explore this website, you will see that a map of Michigan in each of its counties is available. You will select the county that you are interested in obtaining data from, and when you click it, it will take you to the site and will have a breakdown of the different indicators grouped by topic area. So for this example, we'll just say that you're interested in child abuse and neglect. You will see here that the most recent data is from 2010, and the different indicators under that include children in investigated families, confirmed victims, and children in out-of-home care. Now, it is important to remember that indicators, you need to analyze indicators and what it could be saying. So, for example, with the current example of child abuse, be sure to recognize that for child abuse or neglect, that being a child in an investigative family does not necessarily mean a child has been abused or neglected. If you look at the confirmed victims in children in out-of-home care, those may be stronger indicators of actual child abuse or neglect. Another possible example indicator is lead poisoning in children ages 1 and 2. This data is from 2015, so it is relatively recent. And if you look, it'll show you the number tested and then the percentage of those tested that were poisoned. Since this number is very low for the actual population of Saginaw County, it is important to take that into consideration that the 13% here that tested positive may not be representative of the actual number of children who would test positive in the entire county. In looking at the pros and cons of the Michigan League for Public Policy Kids Count in Michigan website, it is important to recognize that this is a snapshot glance at how counties are doing in comparison to others. But also be sure to recognize that counties vary differently in many ways, including geographic spread, available resources, and the rankings do not provide a complete look at the picture of a particular county or in comparing one county to another. Take into perspective, for organizations serving multiple counties, this could be useful to look between the counties that they serve. It is also important to note that for some variables, it is common for data to not be representative of what is going on due to underreporting. This could particularly be true for child abuse and neglect, as there may be more instances of this occurring where it is not being reported to be investigated. It is also important to note that higher numbers could possibly be an indication of better reporting. So it is not to be assumed that just because a number may rise for a variable, in this case we'll use child abuse, that this is a negative and that there is more child abuse occurring. It could possibly indicate that more cases are being reported, which would be a good thing. Multiple sources of data mean that response rates also vary. The data is collected differently and that the same number of individuals in an area are not saying the same things for each measure. Other pros and cons of this website are listed on the current slide. The next data source that we will be looking into today is American Fact Finder. The data sources for American Fact Finder include the decennial U.S. Census, which is conducted every 10 years and surveys every resident of the United States. It is used to count every member of all U.S. households and provides general demographic information on each household member. The response rate for the 2010 census was 74%. It also provides data from the American Community Survey, or the ACS. The ACS is an ongoing survey by the U.S. Census Bureau that randomly samples 3.5 million addresses each year throughout the U.S. It uses a series of monthly samples to produce annually updated estimates for the same small areas, census tracts, and block groups, formerly surveyed via the decennial census long-form sample. The new small area statistics with 5-year estimates are produced annually. The Census Bureau also will produce 3-year and 1-year data products for larger demographic areas. The ACS is legally required to be completed and had a 2017 response rate of 93.7% for housing units, which include houses, apartments, mobile homes, groups of rooms or single rooms that are occupied as separate living quarters, and a 94.7% response rate for group quarters, which are defined as places such as college residence halls, residential treatment centers, group homes, military barracks, or skilled nursing facilities. The information in the ACS is used to make estimates for a county, city, or state, and the information that is collected is much more in-depth than just the demographics that are collected from the decennial census. Example indicators that you would be able to obtain from these data sources are education, economic including poverty, housing information, and information on veterans. An explanation of the symbols on the American Fact Finder site is available at the bottom of each page and includes an N entry as the estimate and margin of error columns that indicate the data for this geographic area cannot be displayed because the number of sample cases was too small. And X means that the estimate is not applicable or not available. Indicator data is going to be available on the left side. You are able to search by a city. For this example, we will look at Lansing, Michigan. As I just described, to the left, you will see each of the different indicators which you are able to break out. So for this example, we will look at income. When you select that, you will see that the 2017 ACS information available, and you will see that there are also selected characteristics available from the 2000 census. If you were to select, we'll say income in the past 12 months, from the ACS, you will see that this brings up the total income, the median income, mean, and the percent allocated. It shows the margin of error, the number of families, number of households, married couple families, and non-family households in this example. You are also able to look at poverty. So looking at the ACS poverty status in the last 12 months, you will see that it's broken down by age, sex, race and Hispanic or Latino origin, by educational attainment, employment status, work experience, the level below poverty ratios, and unrelated individuals for whom poverty status is determined. The pros of American Fact Finder are that it's searchable by small areas. So you're able to search by county, city, town, or zip code, and that you have both census data or ACS data available, and that the categories of indicators are provided on the left-hand side of the site. The cons is that sometimes the data can be presented in a way that is not easily understood and is not always the easiest site to navigate. And when you're looking at smaller areas, such as city or zip codes, some variables may not have enough data and so are suppressed. The next data source we're going to discuss today is the County Health Rankings and Roadmaps. This site has various data sources, including the ACS and the Behavioral Risk Factor Surveillance System. We had already discussed the ACS, but the BRFSS, or Behavioral Risk Factor Surveillance System, is an annual CDC random telephone survey that completes 400,000 national adult interviews each year on health-related risk behaviors, chronic health conditions, and use of preventative services. Response rates are provided by state, and for 2017 in Michigan, the response rate was 47.3%. Data sources for each indicator are available in the 2019 County Health Rankings Key Findings Report. When opening this report, If you scroll down, you will see a summary of key findings. And as you get further to the bottom, you will find data definitions and sources for each of the indicators. Here they are broken down by category, so health outcomes, health factors, health outcomes, health factors, and demographics down here below. For each of the indicators listed here, it shows you the source as well as the year that the data was collected. When going to the website, you can search by state or by county. For this example, we will search Saginaw County in Michigan. And you will see as it comes up to the left, you will see each of the counties throughout the state of Michigan listed by rank. Once again, remember, rank can be useful in getting a general idea of comparisons between counties, but you also need to be careful to recognize the differences between counties in a variety of ways. Here in the middle of the page, you will see each of the different indicators, the county percentage or rate, the error margin, and then also here to the right, the total Michigan. If you are interested in just pulling up one indicator, you will see that it takes you to a map that shows you the different differences between the counties across the state. If you go back to the rankings, once again, it'll show you the rankings based on the measure or indicator that you selected. If you click on download, you can see here that for each of the years, you can download a summary report, the full data for Michigan, and the outcomes map as well as the factors map. To compare counties, you will select a state. And for this example, we'll select Berrien. And we will select Delta. Now these are very different types of counties, but this gives you a general idea of how you can look at the data. This is a great site that has a lot of different information and a lot of indicators. Some indicators that you may be interested could include alcohol or drug use, violence, school or community connectedness, academics, economic, or poor health information. The pros of the site are that there are various variables, including, for example, if you are interested in sexual violence, there are a number of sexual violence indicators. It's searchable by state or county. The data is recent, and it provides county ranks. The cons are that it can sometimes not be the most user-friendly site. You have to know where to find the data that you're looking for in the format you're looking for. Not all data is from the same years, and there are multiple sources of data. The next site that we'll look at is the Kids Count Data Center. Once again, this has various data sources, which can include the U.S. Department of Education, ACS, the CDC. Data sources are available through the Kids Count data definitions. When opening this data book, you will scroll down and you will see that each of the indicators is listed with a definition and also the source of the data, which is very handy to use. And when you go to the site, you will select the state that you are interested in. After selecting the state, if you are interested in looking at county or city level data, that is available. Some data for congressional districts for larger areas is also available. And then if you scroll through, you will see the different indicators. Basic demographics, you'll see that it's broken down by age group, by race and ethnicity, by family nativity. And then you get into the economic well-being indicators, including employment and income, public assistance, housing, poverty, and other economic well-being. Some of this information is also available by race and ethnicity or by family nativity. They also have education indicators, family and community indicators, health indicators, and safety and risky behaviors indicators. This site has a lot of information, which is great to use for a variety of projects or topics. When you scroll back up to the top of the site, you are also able to search by topic versus location if you're interested in that. So you'll see that they are grouped together. So if you were interested particularly in education indicators, you can select here. It automatically comes up as the United States, but you can select a state, a territory, or a city to break it down further if you are interested in looking at that information. Some example indicators that you may be interested could include the demographics, economic, education, health, or the safety and risk behaviors. The pros of this site are that it has national, state, and county level data available. It is a very thorough source of data with a lot of indicators available. The data is recent. It is updated annually with any new indicators that are available. And the site is very user-friendly and easy to navigate. The cons are, once again, it has multiple sources of data and not all the data is from the same years. The last data source that we will be looking at today is Community Commons. Once again, it has various data sources, including the CDC, the ACS, and the CHR. Data source information is provided on the site for each indicator. When opening the web page, you will want to click Explore Maps and Data, which is at the top. You are then able to search which area you are interested in looking at. For this, we will put Kent County, Michigan, which will bring up the Kent County and Grand Rapids area. When you select Add Data, you will see a variety of indicators that pop up. There are numerous ones. You can also search if you are looking for a particular indicator. For this example, we'll look at alcohol and other drug deaths. When you click Add to Map, you will see that it's shaded in, and here is the map key so that you understand what the data is telling you. When you click on the indicator, you will see that it gives a brief description, a more thorough description, and also provides the source and a link to the data that was pulled for this indicator. If you want to look at multiple indicators, you can just select which indicators you're interested in, and you will see here to the side that they show up. And as you click through them, and unselect the ones that you are not interested in, you will see that the data changes based on that indicator. This site has many indicators, and some examples that you may be interested in could include demographics, economic, education, health, and risk behaviors. The pros of this site are that it provides state and county level data. It is a thorough source of data. The data is recent. It is easy to navigate and use and has a variety of indicators. The cons are that it has multiple sources of data. Not all data is from the same years, and the maps could be confusing for some people to interpret. After reviewing the different sources of data at the local level, the state level, and the national level, it's also important to recognize that there are many other possible sources of data. This could include your organization, universities, community organizations, foundations, county health departments, and local schools. When using state and national data, state data is going to show state trends and scope of the problem within the state. State data is usually updated, and it's good for showing the extent of the problem at the state level. It can also be used for county and state level comparisons, recognizing that you may need to be careful in how you present this information, as once again, county level data varies very differently dependent upon a county's population and resources. National data shows national trends or scope of the problem. The data is updated, and it's good for showing overall picture of the problem at the national level. It can be used to do state and national level comparisons, recognizing that states vary differently from one another. And now that we've looked at a few different local sources of data, we're also going to look very quickly at a few different state and national level data sources. The first we'll look at is America's Health Rankings, which is a site that provides state level data on various indicators, including health behaviors, community and environmental variables, health outcomes, policies, and clinical care. The site also provides measures related to various health indicators such as violent crime and insurance status. The site is very user-friendly and easy to navigate with recent data from valid sources. When pulling up the site, you will see that I have put in, for this example, the indicator of infant mortality, looking at the general population, which is the only population available for this particular indicator. We're looking at Michigan data from 2018. So this shows the 2018 infant mortality data for Michigan and also in comparison to the United States. You will see at the bottom that the source of the data is available. When you select the Michigan in 2018 tab, you will see a summary of Michigan data for 2018, including strengths and challenges and highlights. If you scroll down here to the left, you will see each of the indicators for Michigan. And as you scroll over, you'll see that you'll have the percentage or deaths per 100,000 population. And this shows you how each of these were measured and what this value in the middle represents. You will also see the 2018 rank in comparison across the United States. If you then select the infant mortality tab here to the far right, you will see that you have a national map with a key at the bottom presenting the data for that indicator. And if you scroll down, here to the left, you will get the rankings of each state as well as the value. Remember once again to be careful when you're doing comparisons between states because states can look very different in terms of population, resources, and more. Over here to the right is just a summary of infant mortality, what the definition is, the data source. And also this is very nice. If you were to use this data, it provides a suggested citation for the data. If you scroll back up here to the top, you will see that you can click on download data. This is very handy for people who are experienced with working with data in the Excel format. And you can also click here, Michigan State Summary, which once again will bring up that summary of the strengths and challenges and highlights of Michigan. This is a really great site to use as it has a lot of different indicators and is very easy to use. The next site that we'll look at is the National Survey of Children's Health. This site has a large amount of data, which is great, but it can also take a while to work through which indicators are of interest to you or your organization. The data is collected by the U.S. Census Bureau nationally via paper or online with randomly selected respondents initially completing a screener survey for inclusion in the survey. Of those that meet the inclusion criteria, one child from each household is randomly selected to complete the survey, with the version of the survey varying based on the age of the child. When we go to the site, you'll see that you are able to select either 2017, 2016 and 17 combined, or 2016 for the data. You can look at it nationwide or also by state. For this example, we will select Michigan. And then it takes you here where you will go under number 2, selecting a starting point or topic. And you'll see that there is the Child and Family Health Measures or the Title V Maternal and Child Health Services Block Grant Measures. When you click the plus sign, you will see that the different areas pop up. For this example, we will select health insurance coverage, which will then bring up the different indicators below. We will click on current health insurance status, and you will see that you get a graph here at the top that shows the percentage for each response that was available to respondents, the confidence interval, sample count, and population estimate. When you hold your mouse over, you will also get a definition what each of those mean. When you scroll a little further down, you will see that there is a chart available that represents the data above. You are also able to select a different state if you would like to compare. For this example, we'll click Arizona, which then brings up both the Michigan and Arizona data, as well as the chart underneath representing both states now. This is a great site as it is relatively easy to look through, and there are also a wide variety of indicators available. The next source that we will look at is the Youth Risk Behavior Surveillance System, or YRBSS. The YRBSS is collected by the Centers for Disease Control and Prevention. The data is a nationally representative survey of students in the 8th and 10th grades on health risk behaviors. Data sources for the YRBSS include one-time national surveys, special population surveys, ongoing surveys, and method studies. The ongoing surveys are going on biannually, including school-based national, state, tribal, and large urban school district surveys of representative samples of high school students, and in certain sites, representative state, territorial, and large urban school district surveys of middle school students. One-time surveys and special population studies are only occasionally conducted. Method studies are also conducted to determine how using different procedures impact the survey results to ensure data quality. When we look at the site, you will see here to the right that the recent data is available. When you select this, you will see that the data is provided in a variety of formats, including SAS and SPSS. This is really great for individuals who are familiar with using and analyzing data and these programs. For individuals that are not familiar with using these programs, if you go back to the main site and scroll down, you will see that they have a data summary and trends report. When looking at this report, as you scroll to the right, you will see each of the different areas of interest at the top of the table of contents, and then the different indicators below. For this example, we'll say that we are interested in sexual behavior. You will see that different data is available. For this example, right here, the table covers from 2007 to 2017 and covers these indicators to the right with the percentages here. It also provides the source at the bottom. Continuing on, you will see different data presented. Some of them are by sex, by race and ethnicity. And once again, by sex, race, and ethnicity. This is for 4 or more lifetime sexual partners. And you can continue on. This is a really great source of information for individuals or organizations who work with youth. The last source that we'll look at today is the Intimate Partner in Sexual Violence Survey, which would be a source that would be greatly used by organizations or individuals who study sexual violence or domestic violence in intimate partner relationships. When pulling up this site, you will once again see that it is collected by the CDC. And when you scroll down, you will see summary and special reports. When you click here, it will bring up a national summary report, and you will see that the most recent data is from 2015. And then below that is a report that includes state level data, which is presented as an infographic, full report, or fact sheet. For this, we will go ahead and look at the full report for national data. And once again, this site would be used by individuals or organizations who study sexual violence or intimate partner violence. So as we go through, there is general sexual violence data available. And then as you continue to scroll through, you'll see that there is indicators for sexual violence of women, sexual violence of men. You'll see the age at first completed or attempted rape or made to penetrate. You will find stalking data and intimate partner violence data. This is a really great source. It's presented in a very user-friendly way and can be used with a variety of information. Now that we have discussed why you would want to use secondary data and how you make a decision to select the data you're going to use and how to present that data, and since we've gone through a few different examples of websites and sources of data that are available to you, now we're going to discuss a few different scenarios. So the first is creating a handout for a meeting with legislators to discuss the local impact of your topic. So you'll want to start by thinking what data is available and what story you could tell with that data. The audience for this would be legislators, and the type of presentation of data that would be best may be an infographic or a one-page fact sheet. Legislators don't often have a lot of time, and so something quick and visually appealing may be best in this situation. The next example is writing a grant for funding a program to address your local community's risk and protective factors for the topic you're working on. Once again, think what data is available, the stories you could tell with that data. For this, your audience will be the grant reviewers, and the type of presentation of the data would be best presented in a grant proposal. The last example is using data for strategic planning with your organization around goals for the upcoming year. Once again, think about what data is available. This could also include in this example your own organization's data, the stories you could tell with that data. The leadership of your organization will be your target audience, and the type of presentation could vary based on what the leadership of your organization prefers.